back at the Mackinac Policy Conference today on behalf of the Michigan Health and Hospital Association. I'm Rich Helppie, the host from the Common Bridge podcast and Substack. And with us now is State Senator Sarah Anthony of the Michigan Senate. We're going to talk about healthcare and whatever else comes up during the next 8 to 10 minutes. Senator, thank you so much for joining us.
Thank you for having me.
How's the conference been so far?
The weather is gorgeous. This is what people pay the big bucks to come to our state. It is beautiful. There's a lot of energy. You can tell this is a very big political year for folks, so you can tell that people are excited to be here. Lots of side conversations, lots of speculation. So it's a good year to be here.
Good for electoral politics, and how about for legislative politics? Anything exciting moving through the House or the Senate in Lansing?
Well, what I hope is going to be moving soon is our state's budget. So as you know, I'm not just the senator, I'm also the chair of the Appropriations Committee. And so we have a statutory deadline of getting our state's budgets passed into the governor's desk by June 30th. So my hope is that...
We might want to cut this interview short so you can go work on that.
You know, we've got lots of staff, lots of moving pieces happening even right now. But I will tell you, a lot of the conversations we're having is around the state's budget and making sure that we get that done on time for the people of Michigan.
And how's healthcare playing into that? Medicaid discussions, any other discussions going on?
It's the biggest conversation happening right now. You know, as you know, H.R. 1, the One Big Beautiful Bill, did a number on our state's balance sheet. We're looking at a $1.2 billion deficit, and much of that is Medicaid and SNAP benefits or food assistance for individuals. So before we can start thinking about any new investments, we have to figure out how we're going to fill that gap and ensure that people still have health care across the state of Michigan. It's not an easy feat, but we're up to the challenge.
Indeed. Medicaid expansion, Medicaid eligibility is a topic across the 50 states. How has Michigan been impacted of late?
Significantly. You know, again, we have so many men and women and children who rely on Medicaid for the basics. And as many folks who will be listening to this, if you don't get the preventative care, if you don't have a primary care physician or just getting those regular checkups, where do you end up? At your local hospital, at the ER, in fact. And sometimes that's triage. It's crisis mode. So we try to make sure that, you know, in terms of Medicaid, that we're covering people so that they're consistently taking care of themselves and preventing that next crisis from a healthcare perspective. But when, you know, the federal government does a number on our balance sheet the way it did, we're going to have to make some pretty difficult decisions this year.
If you could have a conversation with the president or the Secretary of Health and Human Services, what would your ask be on behalf of the state of Michigan?
That is a profound question because I've never thought of it in that way. I would say what I tell anyone in my role as senator is to lift up the voices of our people. And people are looking at everything being too expensive. And healthcare is one of those things that, for some things, you can't get back. And so prioritizing our healthcare alongside, you know, reductions and efficiencies that we can all figure out in state government, but healthcare has to be that top priority for our country. It is so important, it's so personal, whether it is dealing with a health emergency, the birth of a child, all sorts of medical issues that arise for people. It doesn't matter your political persuasion. Health is health, and that's something that we take really seriously.
And some people may have never walked in the shoes of someone that had food insecurity or didn't have health coverage. And, you know, you mentioned both the SNAP benefits and the health benefits as being important parts. Has there been any discussion about linking them? Because we know so much of disease state comes from bad food.
That's right. That's right. There's so many conversations, whether it's addressing food deserts in some of our communities so that people actually have fresh options, whether it is making sure that our family farmers get the resources they need to put fresh food on the table. We led the charge on making sure that kids eat breakfast and lunch every day. It was a big fight last year to have universal school meals so the kids weren't hungry. So these are some of the investments and ideas that are floating around the table. And I think that at the end of the day, none of these issues are partisan. You haven't asked me yet whether I'm a Republican or a Democrat, and I hope folks realize that these issues are just issues that are important to Michiganders and people across the country. So I'm excited to try to get creative around how we address these issues.
Well, I wish more people didn't care about party affiliation and cared more about policy, because we all have to solve problems, right? That we all need medical care, whether we're of one political persuasion or the other. We all need to eat every day. And there was a day when those kinds of things transcended the political system, or those good people like yourself that have been elected to serve went there to fulfill those needs. And I'm an optimist. Hopefully we can get there.
I think we can. And I'll tell you this, my district, the 21st district, which is Ingham and Eaton County, it is kind of a microcosm for the entire state. I've got an urban population, suburban areas, and very rural areas as well. So when I talk about healthcare, it can be right on the south side of Lansing or on a very remote farm in Charlotte, but everyone needs the same care. And when a crisis happens for someone, they don't care whether, the paramedic is a Republican or the physician is a Democrat. They want to make sure that they're going to make it home to their family.
Indeed, and I understand you've been doing something around medical debt too. Tell us about that.
This has been a cool partnership that we've partnered with the Health and Hospitals Association and really individual hospitals across the state. We know that so many folks are saddled with medical debt. 700,000 Michiganders right now are struggling with some form of medical debt. And people don't know about the charity care programs that many of the hospitals have. So we have a bill that's designed to both make sure that every single individual who is in need actually understands the value and what's at their disposal related to charity care or financial assistance programs. And then we also want to make sure that medical debt doesn't end up on people's credit reports, so that, whether you have a birth of a child or a heart attack, that doesn't become something that spirals into bankruptcy. So these are things that I'm excited that we've worked with the Hospital Association to get done.
Those seem like very valuable and worthwhile things. Any last things you'd like to present to the listeners, the readers, the viewers of this podcast?
I'm a hopeful person. So the thing that you should know about even those medical debt bills is they're bipartisan and bicameral, which means that there's so many folks who are thinking just like you. Those are easy. Finally, we can look for things not that divide us, but that actually unite us. So I'm excited to get those to the governor's desk this year.
Well, I wish you the best of luck on behalf of all of us in the state of Michigan.
Nice.
We've been talking to State Senator Sarah Anthony about health care and related issues that affect citizens in the state of Michigan. On behalf of the Michigan Health and Hospital Association and the Common Bridge, this is your host, Rich Helppie, signing off.